Hello, Mr. Green. Today we are going to be going over some of your test results. We'll start off by going over your lab results. Your total, there wasn't really too many concerns. I'll go through each one number by number. However, most of them looked pretty good. Your total cholesterol was 170, which is under 200, so we're not concerned with that. Your low density lipoproteins, or your LDLs, were 100, which is under 130, so we are not concerned about that. Your HDLs, or high density lipoproteins, were 50, which is over 40, so there's no concern there. And then your triglycerides were 90, which is less than 150, so we are also not concerned with that number. However, your blood glucose levels were a little high. You were at 120, which is over 100, so there's some current concern for diabetes in that category. What I would want to do with that is suggest that you take another test, because with blood glucose, the numbers can really be affected by if you had eaten or drank anything before the test. They can skew those numbers and sometimes not give you a perfectly accurate reading. So I strongly recommend that you get that tested again, and if that number is still high, based on your family history of diabetes, there could be an issue there, and I would strongly suggest that you meet with a dietitian and make some changes to your diet. Those are the lab tests. Now we'll move on to the exercise tests, which there was certain areas that there was some concern with. Nothing that a little exercise can't help out with, so we'll go through those numbers, and as we go I will give you some exercise prescription along the way, things that we can help to improve some of these numbers. Starting off, your resting heart rate was 80, which is between 60 and 90, so I'm pretty comfortable with that. However, I think that number will improve if you follow some of these exercise recommendations. Your blood pressure, that was a little high. It was 145 over 92. And what we would like to see that number be at about 140 over 90. So you're kind of in that pre-hypertension range with that. But again, that number should increase as we start some exercise programming, as well as after you meet with a dietitian and possibly change your diet a little bit. We should be able to get that number down. It's not to a point that we're extremely concerned with it. However, we want to get that under control through diet and exercise, so we don't have to move on to medications and try to deal with it that way. Next was your push-up test. You did 11 push-ups, which is slightly below average. What I would like to see you do to try to improve your strength of your chest and your upper body is 3 times a week. Starting off, we want 3 times a week. I want you to try to do 50 push-ups 3 days out of the week. Now, this isn't necessarily doing regular push-ups. I'm alright with you moving to your knees and slowly progressing through. So for an example, if you can only do 11 like you did on the test, then do 11. You can take a little rest and then try to do 11 more from your knees, and then just keep building towards that cumulative 50 reps of push-ups. Once you begin to get comfortable with that and it's starting to get a little bit easier, maybe it's 2 weeks, maybe it's 3 weeks, maybe it's 4 weeks, whatever it may be, just once you're comfortable, I would like to see that number increase. I would like to see the number of push-ups that you do without using your knees increase. And then once you get to a point where you can do 50 push-ups without using your knees at all, whether it be in 3 or 4 or 5 or 6 sets, then I would like you to increase that number of push-ups per week to 100 push-ups. So our end goal with increasing your upper body strength would be to do 100 push-ups 3 times a week without using your knees. But by using your knees and not using your knees and splitting up the reps into different sets, that's how we're going to progress through. That's what I'd like to see. Now with your curl-ups, you did 6 curl-ups, which definitely needs improvement. That's showing that your core strength is lacking a little bit. So 3 times a week again, I would like to see you do 3 different exercises I will be more than willing to show you these exercises when we go out into the weight room. However, just to explain them, I would like you to do 50 knees to chest, so you'll be laying on your back, and you'll bring your knees and your feet up towards your chest, and then straighten them back out. 50 of those, 50 leg lifts, so you'll be on your back still, legs will be straight out, and you will just pick those feet up off the ground about a foot or so, and then lower them back down 50 times. And then 20 negative sit-ups, which you will position your body to where you'll be sitting upright. If you start off with your legs straight, it'll be a little bit easier, but as you progress through a little bit, you move those legs in so your feet are flat on the ground and your knees are bent. You'll be seated in an upright position, and then allow your upper body to lean back towards the ground, so your shoulder blades will be moving towards the ground. And you want to try to control that motion as much as you can. Once you get back to the ground, we'll probably put a pillow or something soft behind where your head and neck will go, so if you do have to plop down, which I want you to resist, then you won't have any injuries there. But what you'll do is resist that motion of going back, and then once you get to the ground, then you can use your arms and your legs and get back up to that beginning position again, and then do the same thing where you're just resisting that motion of letting yourself go down. 20 of those, so 3 times a week, 50 knees to chest, 50 leg lifts, 20 negative sit-ups. With your sit and reach, the max score on the FitnessGram protocol is 12, and you had 19, so I did not see any issues with there, which means your lower back and hamstring flexibility is right where we want it to be. And then looking at your body composition, your percent body fat was 31%, which puts you in a overweight or obese category. And then your waist circumference was 110, which is too high. We would like to see that number around 88 centimeters. And then the body percent fat, we would like to see closer down in that lower 20s range. The 31% body fat that you had was in the 7th percentile, which is well below average. And as I mentioned before, the waist circumference was also a number that we're not happy with, and we would like to improve. So some exercise prescription that I would like to prescribe for this would be some aerobic exercise. So basically what I would like you to do is walk, specifically 3 times a week for 30 minutes. I would like to see you try to walk, and then that 30 minutes can be split up into 10-minute intervals. So based on your busy schedule, or just maybe not being able to perform these exercises or that aerobic exercise, you can split it up into those 10 minutes and make it a little easier for you. And then I would like that 3 days a week to eventually progress to 4 days a week, and then 5 days a week. Now with these 3 different exercise things that I've recommended for you, for the push-ups and for the upper body strength, the core strength, and then for the cardiovascular aerobic exercise, I noticed that you are an avid watcher of NASCAR. So what I would recommend, since you're probably going to be allotting some time for watching NASCAR anyways, that you incorporate some of that exercise into watching the races. It's not going to really take any time out of your day. It just may make for watching the races be a little less relaxing. However, it's going to be very beneficial for you to start to move your body a little bit, and I think you'll be surprised at how much it's not a grind for you to get through that exercise if you have the TV to watch while you're doing it. Now moving on to your risk factors, you had quite a few of them. I'll go through specifically and tell you your age is a risk factor. You are 55, and any male over 45, that becomes a positive risk factor for disease. You're a smoker. You do not exercise as much as you should be. Based on your skin fold testing and your girth measurements, you are considered obese. Your blood pressure is a little bit higher than we like to see, so you are in a pre-hypertension phase, or you have risk for high blood pressure. And then based on your blood glucose test, you are at risk for diabetes with that number. So those are 6 risk factors there, which we would like to decrease those down to 0 if possible. That puts you in those 6 risk factors put you in the moderate risk factor, or puts you in the moderate category for risk of disease, which means that you can start exercising at a submaximal level. So these exercises that I've given you, you're good to start with those. However, if you would like to move to more vigorous exercising, then you would need a medical examination and a graded exercise test, which would have to be supervised by a doctor. Other than that, I think if you stuck to this exercise prescription as well as met with a dietitian, I think these numbers can improve. And then the other thing would be with some smoking cessation. I wouldn't expect you to be able to stop smoking right off the bat, because you are currently smoking 2 packs a day. However, just like with anything else, I think we could progress to maybe cut that down a little bit and have a goal of getting to 1 pack a day. Maybe not even a short-term goal, just slowly progress at a pace that is comfortable with you, but definitely try to get that number down to maybe a pack a day, and way down the road possibly not smoking at all. And that's it.